All right, thank you, Mark. Tonight in Medical Rounds, prostate cancer is the third leading cause of death in American men. 1 in 7 men will be diagnosed with prostate cancer during his lifetime. Hartford Healthcare is bringing awareness to this disease with a special class coming up to educate men about prostate cancer and their treatment options. Dr. Ryan Dorin will be presenting the class. He is a urologist at Hartford Healthcare, Tallwood Urology and Kidney Institute. Thank you so much for being with us tonight, Dr. Dorin.
Oh, thank you for having me.
Well, with September being Prostate Cancer Awareness Month, what do you want men to know about prostate cancer?
Well, prostate cancer is the second most common cancer diagnosed among men behind skin cancers. And although 30,000 men a year unfortunately do die of prostate cancer, it is very curable if it's caught early, and therefore early detection is very important.
And we talk about early detection. Are you talking about the PSA test?
PSA screening, as well as physical exam with your doctor and a conversation with your doctor about how to go about screening.
Okay.
Yes.
All right, so we got that out of the way. Make sure you get that PSA test. For many men, it can
Absolutely.
be difficult, though, to navigate a prostate cancer diagnosis. You know, there's so many different types of treatment options. Tell us a little bit about that.
Sure. So there are a lot of treatments out there, and they depend on whether or not the cancer is caught early or whether it's caught later. Fortunately, in both situations, there are a lot of new available therapies that are very effective. If you have a cancer that's still in the prostate, the state-of-the-art nowadays is either having robotic surgery for prostate removal or specialized radiation therapies. There are also new techniques involving use of ultrasound energy or laser therapies to eliminate the tumor while saving the rest of the prostate. And finally, if you have a very small tumor, which is slow growing, that can be monitored with what's called active surveillance, where you actually don't have to get treatment right away.
All right, well, that brings me to my next question. What is the difference between what they call watchful waiting and active surveillance?
Great question. So watchful waiting is a management strategy where you don't treat the cancer unless it's causing the patient pain or other problems. And then when you do treat it, it's not intended to cure the cancer. And that's usually reserved for men who are very, very elderly, who have other health problems that are probably more important in those patients. Active surveillance, on the other hand, is something that we offer to men of all ages if they have a small, slow-growing tumor, where you monitor the cancer, and if it begins to grow, then you treat it with an intent to cure it. And in doing that, some men are able to avoid having to have treatment for several years while not losing any of the advantages of the treatments that are available.
All right, I see the distinction now. Thank you so much, Dr. Dorin, for sharing this important information about prostate cancer with our viewers.